Now, the Lagos State Ministry of Health has reported 29 deaths and 579 cases since the cholera outbreak began about 2 weeks ago. The State Commissioner for Health, Professor Akin Abayomi, explained that the death rate was due to patients being presented late at the hospital or brought in dead. He added that no case had been reported in any of the schools in the state. The commissioner called on residents of Lagos with suspected cases to report to the hospitals as treatment is free in a bid to slow down the spread. Lagos State Commissioner for Information and Strategy, that's Gbenga Omotoso, now joins us to discuss this outbreak and steps being taken by the state government to bring it under control. Good afternoon, Mr. Omotoso. Thank you for joining us here on Newsday.
Yeah, good afternoon. Thanks for inviting me.
Of course. Let's begin from the delay or the hesitation when it came to reporting cases or people being brought to hospitals when they were already dead. From the information that you have on ground, what were the factors that contributed to that, to those delays?
Well, I think it's a personal thing. First, let me just sympathize with the families of those who have died in this incident, in this outbreak, and then to say that specifically about your question, that those who come to hospitals late is a personal thing. When you have this kind of encounter, an outbreak, you take personal responsibility for yourself and even for the community where you are. So if you notice anything in your body that is not usual, that is not right, then you rush down to the hospital. But most of these people, as has been said by the Commissioner for Health, Professor Akin Abayomi, they either presented themselves late or they just were brought in dead out of ignorance, out of not taking personal responsibility, and out of not looking at what is going on around them.
Now, there have been so many rumors about the origins and the sources of this outbreak. Is there any clear information as to where the source of the outbreak emerged from? Secondly, can we share a little bit of education about how to ensure that we don't pass on and continue transmitting this disease? Because, again, there's so many rumors now. Some people are saying don't take tiger nuts. Some people are saying there's, adulterated drinking water. So many things being thrown out there. So can you just give us some clarity?
Yeah, thank you so much. First is to tell Lagosians and all those who are interested in this public health matter that it's no use getting panic about it at all. We shouldn't panic at all because the government of Mr. Babajide Sanwo-Olu, the governor, is on top of the situation. All of the sources that people have alluded to, we have checked. And then our experts are working on all of the things that they have seen, taking samples, the tiger nuts you spoke of, water that people are drinking, and everything that is going on, even the food that people are consuming, to actually trace the origin of this. So I feel it is very early now to rely on speculations, on some thoughts that people are making about it. All I can tell Lagosians is that they do not need to panic at all. The state government is on top of the matter. The Ministry of Health is working with all the other ministries that have one thing or the other to do with this public health matter. Ministry of Information and Strategy, Ministry of Environment, Ministry of Fiscal Planning. All of us are working together to ensure that Lagosians do not panic at this time and that they have the best expert advice that anybody can get anywhere when you have this kind of outbreak. We are experienced about in this kind of matter. We had Ebola, we had COVID-19. So Lagos State government knows exactly what to do when you have this kind of problem. And this is what we are doing. And we are telling the public not to panic at all and to stop all these speculations.
All right, Mr. Omotoso, you've touched on collaborative efforts that are being made by the Lagos State government in conjunction with other agencies. And you're also, of course, asking Lagosians not to panic and that you're on top of the situation. But can we get quite specific, if you don't mind, what is being done to address the root causes of cholera, for instance, like poor sanitation and lack of clean water? Can you give us specifics as regards what's happening so that there's, in fact, no panic and no speculation?
There are so many things that can cause cholera, and in this particular instance, we do not want to just say it's a particular thing that has caused it. Like I have said, it's a public health matter, and all our agencies are working on it to be able to pinpoint exactly what has gone wrong. It could be water, it could be food, it could just be carelessness of people who are involved in open defecation. It could be just people who are not cooking their food very well before consumption. But we do not want to tell the public that this is what has caused it, because there are so many things that we are investigating, and then it's an open-ended investigation. It's not something that we just say, well, we are going to conclude in 48 hours or in 24 hours. But all I know is that all of the things that I could bring about cholera, they are the sources that we are investigating, and our experts are working on them. And I trust that by now they will have come up with something, but they are still working. It's not, I'm not an expert in this area, and it will not be right for me to just say that this is what has caused it and this is what we are going to do about it. But all I know is that all the efforts that we are putting together, the multi-agency efforts that we are working, the Emergency Operations Center that we are running has shown clearly the facts and figures that the incidence is declining.
But Mr. Omotoso, I wasn't really asking you about the causes anymore. I'm asking about the efforts. Because when you see metrics, when you see things when you see these efforts, that's when you can actually reduce the panic or speculation. So I'm just asking for what you can actually see, take off and say, oh, if an everyday Lagosian looks at your efforts and says, oh, this is what the state government is doing, they can actually see it. So what should we be looking out for to know for sure that the government is on this? That's what I'm asking for, not causes anymore.
Okay, the efforts that we have made, like I told you, we have stepped up advisory, we have stepped up a campaign, advocacy about cholera, the causes of cholera, and what people should do if they suspect that they may have a cholera. If you are stooling, if you are dehydrated, you rush down to the hospital, no need to stay at home. So we have stepped up advocacy. We have stepped up efforts in finding the source of the outbreak, and we are working with so many organizations to see that people have access to whatever they need in terms of going to the hospital and being treated free of charge for anything that is suspected to be cholera.
Okay, and of course what we do know is that cholera and water, especially contaminated water, do go hand in hand. Majority of Lagosians experienced the downpour yesterday. It was quite an overwhelming day for most parts of the state. And so the question is, you know, what's being done? We hear Kaduna State has sent instructions for some of the channels where there's waterlogging to be open and so forth. What are the efforts that are being made, and what really happened yesterday? Because we haven't seen that level of flooding in Lagos in a number of years. And, you know, of course, like I said, because cholera and water, they do go hand in hand.
What happened yesterday was a justification of what the state government has been preaching, that the environment belongs to all of us. We need to take care of it. We need to be in love with our environment, and we need to do everything that we make the kind of things that we are seeing in cholera and the delay that people had on the road yesterday not to happen. And how do we do this? We ensure that we clean our drains. We ensure that the drainage channels are not blocked by anybody. And that is why the government went about demolishing buildings on the right-of-way of drainage channels. And so many people were criticizing us at that time. Now we have seen it. Just the effect of climate change, the effect of global warming, the effect of all of the things that we have been talking about that we need to be very careful about and do what we need to do. Is the responsibility of all of us as Lagosians to ensure that the drains are clean. We banned plastic, and then people were complaining. I mean, plastic blocking drains and people building on the right of way of drainage channels. These are the problems that we are seeing. We are now seeing the effects of all of these things that we've been talking about. And that's what happened yesterday. We had an unusually high volume of rains. I mean, for hours, the rains were pounding the city. And of course, it's a natural phenomenon. There's nothing anybody could do about it. And so it's also natural that we have, when you have that kind of situation, that the volume of water is high. We also have what we call flash flooding all over the place. But you will agree with me that if you go all around Lagos today now, in most cases, 90% of the flood will have been gone.
Thank you, Mr. Omotoso, for expanding on that. Now, of course, you know the current state of affairs when it comes to the Nigerian economy, inflation, and whatnot. And now cholera is also, is also contributing to the difficulties that we're experiencing in the state. So I'm just wondering what economic impact you anticipate that this outbreak could have in Lagos and steps that are being taken probably to mitigate it.
It's very simple. If you have this kind of outbreak, you can slow down the man hours of people who are working. People will not be able to put in their best because if you are ill, you cannot put in your best. And that is why the state government is saying that all our hospitals, primary health care centers, the general hospitals, they are open, and this is a public health matter and is going to be treated free of charge so that people don't have to stay so long at home without treatment, and then we are losing in terms of economic input of the workforce. So we are encouraging people to go to hospital. Definitely when you have this kind of thing and it's general like this, it will affect the production of people, it will affect the GDP, but thank God in Lagos, the rate at which we have it now, it's not enough to have any major impact on the economic situation of the state.
All right. And lastly, I know you have mentioned that there's a lot of free support being given. Two things. Where are those locations that people who suspect they have the symptoms, where should they head to? And secondly, the vaccine. Of course, we know there's a cholera vaccine, but it seems there's a shortage of this vaccine. What is going on with the availability of getting people vaccinated against cholera as well?
Well, we have hundreds of primary health care centers in Lagos, and we have general hospitals too. About
so they're all free when it comes to treatment of cholera?
Yeah, treatment of cholera is free because it's a public health matter. Nobody's going to be charged a dime for going into any of our primary health care center, over 300 of them all around Lagos, and then the general hospitals too. If you go there and you present with symptoms of cholera, the person is going to be treated free of charge.
All right, we just have about a minute with you, Mr. Omotoso, and of course you do know that some people have paid the ultimate price based on this disease. Wondering if there's any support that's being given to the families of those that that might have lost their breadwinners or their family members in this health situation, this crisis.
The normal thing that we do, when I started this conversation, I said I sympathize with the families of those who lost their loved ones in this outbreak. What we usually do is that we provide psychological support, we provide advice for them, we ensure that it does not become a chain of deaths in the family. We ensure that what may have caused it, likely causes, are blocked, and then we advise the people on what to do. And most importantly, we provide them psychological support so that they do not, go down with the incident.
All right, Commissioner for Information and Strategy for Lagos State, Mr. Gbenga Omotoso, it's always a pleasure to be in conversation with you. I do hope that everybody's gotten the memo about cholera loud and clear. Let's stay clean, wash our hands, and make sure to drink clean water. Thanks so much.